Hey YouTube! Today is Monday, June 15th. That could be a lot. Let me check the calendar. It's the 15th, yay! And little Miss Cecilia had a pretty good night. Hi! Hi! And let me show you her cuteness. Hi! This is the shirt that my friend got me. It says, You will soon learn that your mommy is a nerd. One day I will teach you all about muggles, the One Ring, and the ways of the Force. And she fits it. It's a 3 to 6 month outfit. Can't believe it. Her torso is so long. So this weekend we had her in a bunch of frilly dresses, and my husband kept saying, like, you need to post it on your Facebook, or you need to like change your profile picture. And I was like, no, I'll do that. Like I'm doing once a month sort of updates so that I'm not bombarding my friends with just pictures of Cecilia all the time. And I was like, oh, today I should probably upload a bunch of pictures because I want to change my profile picture to this little girl in this little outfit. So as you may notice, I chopped off my hair completely. Hi! I asked for it to be collarbone length. It is not collarbone length. I noticed that she was kind of nervous. Oh, hi. She kept asking me, like, is this the right length? Do you want it this length? Are you sure you want it this length? And then when she cut them very uneven, and so she had to make one side shorter. And then when she was doing the layer part of it, she just kept cutting the perimeter of my hair, and so it just kept getting shorter and shorter. And she wasn't done cutting, and she took about an hour and a half to cut my hair. And I was like, you know what? I'm done. So I said, I really like it. I have to go. And so I left. And she was like, are you sure? Because I think I need to like thin out the back a little bit. And I was like, no, I think I'm good. And she was like, okay, well just let me know if you want me to take it up a little bit in the back. And I was like, no. I don't want you touching my hair anymore. Hi. But it's just hair, it'll grow back. I'm not like worried or anything about it. Yeah, it's just shorter than I would like. I can't put all of my hair up completely, so I have like, it looks like a weird mullet. But that's okay, that's fine. Another little piece of news this past weekend, I had a big lump on my left breast. And by left, I mean right breast. And so I put a rice heating pack on it, and I think I made the rice pack way too hot because it hurt. And so I was like, oh no. So I took it off real quick, but I had these huge red burn marks on my boob. And then from then on out, I was like, maybe it's mastitis. Oh my gosh. Oh no. But I burned myself with a rice bag, so I think that was my problem. I have been nursing her more on demand. I've been changing up my hold, nursing her on my right side first, also using heating pads. I've been using green tea bags for my nipples, which seem to be helping a lot. There's hardly any pain on the left side when she latches, and the right side still, it hurts when she latches. Yeah, I've been trying the football hold, which I seem to have missed the boat on the football hold. The nurses at the hospital were all trying to push for the football hold, and I just found it super awkward, and I felt like I was crushing her legs next to me. Hi. And my arm felt weird. It was just like not a good situation. So yeah, I've been trying the football hold with my husband's help. Like I have the breast friend pillow, and then I'm like trying to get her head in the right position, and it's always too far back or too far forward, and it's a big old mess. So I did do 2 football holds, and last night I tried laying on my side and nursing her, which worked. And the latch was so much better. I got her to latch completely to where like just the initial latching was hurting, and then it would go away. So yeah, nursing on your side is amazing, and it helps your back so much. So if your back is aching from awkward positions or what have you, nurse on your side. It's awesome. I'm gonna try to nurse both boobs on my side. It was a little awkward doing the other one, so I need to like revisit that, and I will tonight. Hi, honey. Hi. I love you. Yeah. So that is my big update for this past weekend, and I will talk to you later. Bye. Hey guys, it's June 16th. It is Tuesday, and I was getting ready to go on a walk with my neighbor, and then it started raining. So I don't think that's gonna happen. Yeah, and I just texted her, and then it started like downpouring. So I'm like, now she thinks I'm stupid. Like, oh, I'm ready to take my baby out in a thunderstorm. Last night was really difficult. Cici woke up at 3 o'clock, 3:30 or so, to do her middle of the night feed, and then she wouldn't go back to bed. Yesterday she didn't poop at all. I know, TMI, but whatever. Mommy blog. Vlog, not a blog. Anyway, and so I think she was just really upset because she needed to, and she was up for about an hour or so, and then my husband took her out of the room, and I couldn't sleep. I kept having like nightmares that she was dying. Ugh, it's terrible. And then I fed her this morning, and she was fussy, so she kept me up another hour or two, and then we got 2 hours of sleep, which was awesome. And then I started my day around 10:30, which was fine. I'm a stay-at-home mom, so I don't have anything else to do but take care of her, which is a huge job. Don't let anybody tell you that you're not working, because you're working. Alright, well, I will update you guys if anything exciting happens. Oh, she did poop this morning, so I think we're all in the clear now. Okay, bye guys. Hey guys, it is Thursday, not Thursday. It is Wednesday, June 17th? Yes, June 17th. I'm here in Cici's room. She's hanging out in her crib. I was gonna get some bib for her, get some bibs, because I'm gonna pack her little diaper bag. So yesterday I wasn't feeling so well, and it turns out I started getting a fever. But I took ibuprofen like right when my temperature started to rise, so I think it only went to like 99.7. I think that's the highest I saw it. But I started shaking and feeling really weak, and I thought, like, I woke up with a sore throat, and I thought like, oh, that's just allergies, like they're really bad today. But yeah, I think it's mastitis. So I'm waiting for my OB's office to open, and I'm going to give them a call, and hopefully they'll give me a prescription for an antibiotic. I started really worrying last night, like, oh my gosh, what if it turns into an abscess? Because I've been saying that I think I have mastitis since Sunday. But I kept thinking, like, no, I just burned my skin with with the rice heating pack. And yeah, so I just felt like, hi little girl. So yeah, I just felt like I let it go on too long, and yeah, now I have real big issues. So I am still able to nurse. It's not any more painful than it used to be. So I don't really know what's going on, but yeah. Anyway, I felt weak and took medication, and I felt a little bit better. Was able to sleep, but I woke up feeling crummy again. Took more medication, and then I was able to sleep for a couple of hours before Cecilia needed to eat again, so that was nice. Yeah, so that is my big update. Yesterday I did not end up going on a walk with my friend. I ended up having 2 other friends come over in the afternoon, and we just hung out and talked, and it was really nice. So that's what I did yesterday, and then today I'm going to go to the doctor's. So I will keep you guys updated if any new news transpires today. Alright, bye! Hey YouTube, it is Thursday, June 18th, and I have a few things to update you guys on. First of all, I left my phone somewhere. So let's do that first. It's my lifeline. I don't know where it is. Oh, I think I left it next to Cecilia. That's probably a good place to leave my phone. Oh, there it is. Okay, so I felt really sick the day before yesterday. I started getting like a low-grade fever, and I just really felt crummy. My throat was hurting. I just sort of felt like weak everywhere, and my friend said that she would help me go to the doctor's because my husband was at work, and I felt like if I had to lift up the car seat, I probably wouldn't have enough energy to walk and lift the car seat. Oh, I'm out of breath. Anyway, so I went to the doctor's, and she said, you have mastitis. It's not the worst case that I've ever seen, but it sounds like you got the whole flu-like symptoms that went along with mastitis. She saw the redness and the heat that was on my right breast, and so she said, keep nursing, and you're going to take these antibiotics 4 times a day. And so I was like, that's kind of overkill. Like, I don't know if I can remember that. She was like, it's really important that we treat this aggressively the first time because we don't want it coming back. So she gave me the prescription, and then I misread the label, and I took 2 pills the first time, and my husband was like, for my second dose, which was 6 hours later, my husband was like, how many pills do you take? And I said 2, and he's like, are you sure that it's not just 1 pill 4 times a day? And I was like, no, I'm pretty sure it said 2. And so I read the label again, and it says, take 1 capsule by mouth 4 times daily. And I was like, oh no. And then I read, I mean, it was already time for my next dose, so, I mean, if I were to have any of the symptoms of an overdose, I would have had those symptoms, like, right after I took it. Excuse me. So, yeah. I didn't have an overdose, thank you. Oh, she's crying. But I did take 2 pills the first time, so I made sure to take 1 pill the next time, and it was all fine. Hi, Cecilia! Look at how cute she is, even when she's crying. Hi, honey! Do you want a pacifier? Do you want one of these? Do you want one of those? Yeah. Do you just want to tend attention. Hi, honey. I love you. That was an attention cry. So, hi. So I started taking that, and then they also prescribed me an antifungal pill to take after I'm done taking all of my antibiotics. And that's because there's a higher risk of the fungal infections, thrush, yeast infections, things like that when you're taking so many antibiotics. So she said, yeah, take it after you're done taking the 7 days worth. Hi, honey. Hi. Do you just want to talk to me? Talk to mommy. She did really good. Last night she slept really well. She's been nursing more often, but I think it's maybe because I'm producing just a little bit less, and so she doesn't get milk drunk like she used to. Not all the time. I mean, she gets milk drunk maybe half the time. But she often will be done nursing and then instantly be sucking her hand and get kind of fussy. So that part's a little frustrating because I'm trying to feed her so much. Yeah. Anyway. Okay, I can't think straight. So I will talk to you guys later. And I hope you guys have a good Thursday. Bye. Hey, YouTube. Today is Friday, June, let's say 19th. I'm not actually sure. Anyway, I don't feel good. I don't know if this is mastitis related. I've been taking my antibiotics, but like my throat is all super swollen and it's hard to breathe and it's hard to swallow, and it's not a good last 24 hours. I was going to take some Mucinex, but the stuff that we have expired almost a decade ago. So I'm just taking ibuprofen and taking it easy. My husband's home today, so he's taking care of Cecilia. And yeah, I guess the only thing that I need to report is, I don't need to report it, but it's kind of cool. I just transferred two huge bags of breast milk to our deep freezer, and so now we have 84 ounces, which, I mean, it doesn't sound like a lot because I've been pumping since like the end of May. Yeah, I think the end of May. But it's a lot for me because I was having a lot of supply issues. So yeah, 84 ounces. I'm happy about that. And yeah, I hope you guys have a good weekend. Better weekend than I'm going to have. Alright, bye.